Now, with regard to the kidney transplants, now compared to 10 years ago, now the kidney transplant has become more common.
Yes.
So, as you know, the nephrologist will maintain the medical part. The primary surgeons who do kidney transplant are urologists and transplant surgeons. So, what is your experience and what any advances? What are the things you need to hit to the public? Because many people think that they have some fear also. So, transplant means it is some completely big thing.
Yes.
So let's not avoid. Let's not go for it. That's also the misconception among the people.
Yes.
So what is your advice on this?
So I have been part of nearly 500 renal transplants over the last 5 years, 5-6 years. So kidney transplant is definitely a life-changing moment for the recipient. So you are giving a new lease of life to the recipient. So in live kidney donation, usually the relatives, mother, father, brother, sister, wife, husband can give. So in India right now, live related transplants are the highest in number. But in foreign countries, cadaveric renal transplant, they do highest number of transplant. And with regard to outcomes among all organ transplants, kidney transplant has the highest success rate.
So this is one of the things because
Yes.
compared to liver transplant,
Liver, heart, lungs, whatever you take, kidney transplant has the highest success rate, close to 90 to 95%.
So what this is again the cost is one of the thing. What is the normal cost in a hospital like in a good corporate hospital like Manipal?
Yeah, if it's a live related renal transplant, so usually the cost comes between 8 to 10 lakhs.
This compared to the liver transplants and all, it is
Liver transplant is almost 4-5 times
4-5
higher
times more than this. The kidney transplant is one of the common transplants, and as the what is the cadaveric is good or live donor is better.
So in ideal scenarios, live related transplant results are better. But because of the lack of donors, so sometimes we have to go for cadaveric renal transplants. So the problem with cadaveric renal transplants is, one is it is done in an emergency situation. The donor, the deceased donor may not be ideal, he may be having diabetes or something like that. The ischemia time is more and the results are little bit lesser compared to live related transplant. But live related transplant or cadaveric renal transplants, whichever is available based on the scenario, it is better to undergo a transplant rather than going through dialysis lifelong.
This is very important. Instead of going to lifelong dialysis, kidney transplant is one of the important things.
So when you have a better option in the form of kidney transplant, you have to go for it. You talk to a patient who has undergone dialysis, who has been undergoing dialysis and who later get a kidney transplant. It will make a massive difference to his lifestyle, the quality of life, everything. He'll be very happy.
How much time it will take for you to OT regarding kidney transplants? What are the important preparations has to be done?
So in scenario of live live related renal transplants, so we usually start with the one team will start with the organ harvesting, the other team will prepare the recipient for the surgery. So once everything is ready, so we remove the kidney and implant it to the bed. So usually it takes around 5 to 6 hours.
5 to 6 hours surgery. Okay. This is like kidney transplant over the last few years. It has been a lot of the people also accepting it as a this one.
Yes.
And it is even compared to other transplant, it is not too much expensive.
Yes.
So it is can be done in 7 to 8 lakhs, nowadays 7 lakhs.
Yes.
So people should consider kidney transplant to avoid a lifelong dialysis.
So over the last few years, the government has also taken many steps so that the organs are not getting wasted. So you can also enroll to donate your organs. So if at all you enroll to donate your organs, so whenever the situation happens, your relative informs the authority. They'll come and evaluate the patient, and if possible, they'll take liver, 2 kidneys, lungs, heart, corneas. So it will give a new life to at least 5-6 patients. So even in death, you can do a noble gesture. So going forward, our country, there is a lot of difference in the donation pool and the organ requirement pool. So cadaveric transplants has to has to become more robust in our country, and that will solve the problem of transplants. And also many needy patients will get the organs and they will be free from the dialysis and they'll have a good quality of life.
Okay. So this is about kidney transplant. In next section we can discuss about robotic surgeries in urological conditions. Now this section will discuss about robotic surgeries. Nowadays it is a trend that there is people are thinking earlier about laparoscopic surgeries, then robotic surgeries, and some people are in a notion that robotic surgery is something like a elite. And I want to confirm with you that what are the common places where robotic surgeries are indicated, like the common indication, and in wherein it's not required. You can go for a normal surgeries also.
So over the last 10 years, robotics has revolutionized the way surgeries has been done. As I told, there are some areas where it has definitely made a difference. There are some places where it is not required. So for places like deep organ, for example, say pelvic organs, the robotic transplant is it has revolutionized and it has given very good results compared to laparoscopy or open surgery. But in terms of urology, radical prostatectomy is one thing where it has made a difference. Partial nephrectomy is one surgery where it has made a difference. Reconstructive surgeries like vesicovaginal fistula, PUJ obstruction, pyeloplasty, these are some of the procedures where robotics definitely is useful. So there are other conditions like if the patient needs a simple nephrectomy or a radical nephrectomy or a adrenalectomy, robotic will not give much more advantage than laparoscopy. So in these scenarios, laparoscopy is equally effective. But in pelvic organ procedures like say for example radical prostatectomy, vesicovaginal fistula repairs, partial nephrectomies, robotics has definitely an added advantage.
Okay. So at least regarding the compared to the laparoscopy, the robotic has little more costlier.
Yes.
And apart from this metros like in Bangalore, Manipal, we have access to robotic surgeries. In a tier 2 cities like Turku, Shumaga, and such places where there's very few places have the robotic surgery.
Yes.
So in such places like in future, do you think this is a necessity?
Yeah, definitely it will come. It's just like another modality, like laparoscopy also initially it was available in metros, gradually it percolated into tier 2 cities, tier 3 cities. Even now the same thing is happening. Right now Mysore is having one robot apart from Bangalore. I'm sure definitely over the next 5 years it will percolate to many more tier 2 cities as well. So and it is definitely helpful for some of the procedures. Going forward, I know cost is one consideration right now, but going forward, and one more thing is now a cheaper and effective Indian-made robot is also in the market. So that has significantly reduced the cost.
Regarding the cost is why robotic surgery is expensive, because robot is expensive.
Yes.
So what is the cost of approximate robot for
So
use the same Da Vinci or something else?
Da Vinci robot has many generations. Usually it will cost around 16 to 18 crores based on the generation. So there are newer Indian made robots, Chinese made robots, which are much cheaper. They are available at 5 crore and 6 crore. So as I told, gradually it will become much more cheaper, and once it becomes cheaper, it will be affordable to all sections of people in tier 2, tier 3 cities also. And we can have this facility in tier 2, tier 3 cities as well.
So like hospital investing 16, 18 to 20 crores for the robot, we can't expect the surgery to be done at a cheaper rate.
Yes.
But the thing is, people should understand that, discuss with the urologist, wherever the robotic surgery is not useful,
Yes.
not 100% indicated, you can avoid it, go for the
Definitely.
normal surgeries to avoid the cost.
Yeah,
It is not like that robotic surgery is show your status level or something advancement. There are somewhere it's not required.
Not
There-
required.
Urologist's opinion and his experience also matters.
Yes, so you take an opinion of your urologist. As I told, there are some procedures where robot definitely has an advantage, and some procedures where you can also do a equally good laparoscopic procedure. So take an opinion of your urologist or the concerned surgeon and decide accordingly. So with regard to urology, robotic radical prostatectomy, robotic partial nephrectomies, robotic VVF repairs, robotic pyeloplasties, robotic radical cystectomy and ileal conduit. All these procedures, robotic definitely has an advantage and you can go for it.
And common thing is what is the time duration? For example, same surgery in a robotic surgery and same surgery with a normal. So which takes more time?
So to be honest, robotic takes much lesser time because of the degree of movement, the dexterity which the surgeon has, the magnification of the vision and less blood loss. So the procedure becomes much more easier for the surgeon, and in terms of recovery, blood loss and outcomes also, robotic definitely has an advantage. So compared to laparoscopy, there may be little bit difference in the robotic surgeries, hardly sometimes in cases of prostatectomies and partial. So there is definitely, it will save some time. Rather than the time, it is the precision, the magnification and the outcomes are good with robotic surgeries.
And common thing, many of my technocrat friends keep asking, in future, when robots can do surgeries, okay, what is the relevance of surgeons then?
No, that is not going to happen. So the common misconception which people has is robot itself does the surgery. That is not.
This is a common misconception. They think that you just fix it and leave it.
Yeah.
The robot is surgery.
No. Robot has arms which are inserted into the abdomen, and surgeon will be controlling the robot. So the surgeon controls the robot. All the movements of the robot will be controlled by the surgeon. So it is the surgeon doing rather than the robot, and robot is just a modality of doing an effective procedure.
So
in an
in
effective
the
manner.
future, it is advancement of AI, technology and all. Now you fix it and throughout the surgery, you do the surgery.
Yes.
Even though it's a robotic, you assist throughout the surgery.
Mm.
Is there a future that with very minimal effort, robot only can do the surgery?
Yeah, that is an ethical dilemma. So many of the research it is directed in this way. So this is also a possibility. I am definitely not denying it. That is a possibility. But because of ethical consideration, I don't think that will happen in the near future.
Because anything introduced in medical, there's always a medical, legal and ethical angle.
Yes.
It doesn't happen like Amazon, Flipkart, whatever this immediately you can implement in the future. So medicine, you deal with the humans, there's always a medical legal angle and also misuse.
Yes.
And you are always like, you should not, we are not even, should avoid even 1% complications also should be answerable.
So all these newer modalities, whatever robot or anything, are better used if it's control. If the surgeon is having a control, then only it will have an added value. Definitely, if you give it a free hand, it won't be having a value what it is having now. So I don't think that will happen in the near future. So, but that is a possibility. I am not denying that.
So robotic surgery is one of the important milestone in the surgical history of urology, even cancer surgeries and knee replacements and other things. But there are many cases when you don't need robot, you don't need to spend the money, you discuss with the urologist and take action accordingly.
Yes.
So this is about robotic surgeries. And one more thing we are discussing, like this uroflowmetry. So any other common like investigative modalities where our general practitioners, other things are not aware, but which has a relevance.
Yeah, so uroflowmetry is one of the common tests which you need to get before evaluating a patient for prostate. So as I told, urine routine, ultrasound of the abdomen and uroflow are the three common tests which everybody should get for evaluation of prostate. So with respect to uroflowmetry, so the uroflowmetry is basically a machine which measures the quantity of urine which the patient has passed, the speed with which he has passed, and the average flow of the urine, all these things. So it gives a graphic curve. So based on that, we will decide whether it is an obstructed curve or a staccato curve. There are lots of curves. Ideally, it should be a bell-shaped curve. So for the GPs who are seeing, you have to look at around mainly 3-4 points. So ideal uroflowmetry, the patient should void minimum 150 ml. So the voided volume should be 150 ml or more to get a proper uroflow test. And you have to look for Qmax and average flow value, and post-void residue. These are the 4 things which you have to look for in a uroflowmetry. Ideally, the voided volume should be more than 150 ml and Qmax should be more than 15 ml per second, and average flow should be more than 5 to 7 ml per second. So if the values are below this, it is called obstructed and needs to be evaluated with a urologist.
Okay. So thank you for valuable insights. We discussed so many things, starting from urological symptoms to kidney stones, kidney transplant, robotic surgeries, and many things. And this video is divided into many sections. People who want individual things, they can go individual video. Others, they can see the timeline in the single video and watch the complete video, whatever is required. So we'll catch up next time. Without you'll say the advancement, we'll catch up with Ravishankar. So thanks. Bye for now.
Thank you.